Good evening. Welcome to iMed. On today's edition, we're going to talk about a condition that a lot of Sri Lankans have come to experience over the last 2 or 3 decades. At least one in every family has got some sort of a condition with regards to this particular disease that we're going to talk about. And to talk about diabetes, we do have with us in the studios Dr. Tharanga Samarasekara, consultant endocrinologist at General Hospital of Kalutara. A very good evening to you, Doctor.
Good evening, Shan.
This particular subject or the condition we call diabetes is something that out of nowhere, I think if we go back in time, our grandparents or great grandparents would have even heard of this situation. But over the years, in the last 2-3 decades, this has become a very common subject people talk about. So to start with, what sort of challenges do we face in 2022 when it comes to diabetes?
Yes, Ishan. Last 2 years had been very challenging to us because our grandparents, they have experienced polio, the pandemic, and our parents malaria, and this is our time to face the challenge. And this is totally different because now there is international travel, we do office jobs, there's a lot of extra activities like we are going on holidays, so everything changed during the last 2 years. So we were confined to houses, our lives are turned upside down. With that, our dietary habits change, so sometimes there were not quality food available, so we had to eat whatever available at home with the restrictions going on. And people who were doing exercises before had to stop because gyms were closed, swimming pools were closed, and they were scared to go out even with the masks on. And the kids, they were staying at home, and there were no group activities for the kids because when we were little we were playing outside, we were playing cricket, like 10 or 20 kids get together, but it's not seen there anymore. And people who are going to the offices had to work from home, so they were looking at a screen like maybe 8 hours a day and looking at the smartphone when they have nothing else to do. So with this thing, there are a lot of changes happening inside our body as well as our mind. There was a lot of uncertainty, anxiety and stress building in the bodies, and there's loss of financial income. Some people losing their jobs because in the coastal belt, a lot of jobs were depending on the tourism. So with that kind of stress to the mind and changing habits to the body, diabetes has becoming increasingly prevalent in these 2 years. And for the 2020, I would predict that we will be seeing more and more patients having diabetes. That is the new cases. Let's say for the people who have already been diagnosed with diabetes, the hospital clinics were closed, and there was lack of access to certain medications. They were out of stock, and there was no regular access to the clinic medications. We were trying our best to deliver it to the home, and there were problems of obtaining insulin. With that, these people's blood sugars were going up, and added to that, there was problems of getting the blood test, getting checked the blood tests. So they were not aware what's happening in their body. So we started to see a lot of complications of diabetes during the next year with regard to their kidneys and hearts. So those are the things that we might experience in this year and the challenges that we are going to face.
So corona pandemic has actually had a greater impact on our health and lifestyles, and it could, as you say, could lead to more cases. Is that the only reason that diabetes is in the rise in Sri Lanka?
Even before the pandemic, the trend was going up, and by being Asians, we have a higher genetic risk, but our ancestors were protected because they were eating good food and they were leading less stressful lives, and they were more mobile than us. And with the development of Sri Lanka, we get increased refined sugars into our diet, and we get reduced physical activities because we had a good transportation system. So people ride their own vehicle or take public transport to the work, so they don't walk. And we have a lot of screen time now because we spend time on the laptop or the phone or the television, in front of the television. So That also leads to increased incidence of obesity as well as diabetes. Then our lives are now, I would say, our ancestors, they had a simple life. They do farming, they come home, eat and then sleep, and the next day they go to the farming again. And life was much simpler in those days. Now we lead a complex life. We have our bank loans, we have our mortgages to pay, and both parents are working now. So we have to wake up early in the morning, hit the road, meet the traffic, go to the office, face the stresses, and that had led to an increase in the incidence of diabetes.
And Doctor, something that we spoke about with regards to osteoporosis in the previous episodes also is that even diabetes was more of a situation that you face when you are old.
Yes.
But increasingly we see a lot of young people having this condition, and even in some cases school going children are diagnosed with diabetes. What is causing this?
Yes, Ishan. Our parents, our grandparents, it was very rare to get diabetes. They developed towards the end of their lives, like in their 70s or 80s. And then when it comes to our parents, they were developing diabetes when they are 50s or 60s. And our generation, now we are developing diabetes when we are 30s or 40s. And it's sad to see. Now I see children, young as like 10, 15 years, developing diabetes. One of the reasons could be the change of the lifestyle, because the kids, they eat a lot of starchy food, they eat a lot of short eats, and they take a lot of sugary drinks. On top of that, they have to spend time in the school, then time at the tuition, so they don't get time to exercise. For a child, we recommend at least 2 hours of regular activities. So I don't think any Sri Lankan child would get 2 hours of daily activities nowadays. So that could lead to increased incidence of diabetes among school children.
Moving from that to, how would someone identify that they have diabetes?
Well, it's common knowledge that people with diabetes, they tend to lose weight suddenly. Then they get increased thirst, they drink a lot of water, and they go to the washroom often. They have wake up several times during the night to pass water. So those are the signs of symptoms of diabetes. But the thing is, like, most people, they don't get any symptoms. They have done a study that shows that 1 in 2 people with diabetes are not aware that they have diabetes even. It's when they go to the routine checkups only, they will know that they have developed diabetes. So majority, they won't get any symptoms even. But when they do get the symptoms, it's the loss of weight, the thirst, the increased urinary frequency, and some patients, they get specific features, like for the males, they get itching of the private regions. We call it balanitis, which is a common presenting feature to the general practitioner, where there is itchy rash in the foreskin and the glans penis. And for the ladies, they can get some condition called pruritus valvae. In simple terms, it's fungal infection in their external genitalia.
So, doctor, say if you do find yourself in this condition, as we spoke about, the age has reduced over generations, and most of our generation in their 30s, 40s find themselves prone to this. How often should they try and go to a doctor or routine checkup in order to make sure that either you have or have not got this condition in you? Should it be once in a 6 months checkup, or should they do it maybe annually, or what should be the frequency like?
Everyone above the age of 35 to 40 years should get at least annual checkup. That's a must. So, but if you have a higher risk, let's say your parents are having diabetes, both parents, or if you have other conditions like cholesterol, high blood pressure, or obesity, then the screening frequency can be shorter. We are fortunate that government hospitals have a good screening system called Healthy Lifestyle Centers. You can just walk in and get yourself screened free of charge. So they check the weight, the body weight, and the height, and check whether you have obesity, and they do the blood pressure, and they do the basic blood test like the blood sugars and the cholesterol, which is available in any government hospital. It's called Healthy Lifestyle Center.
So how would you prepare yourself for these type of blood tests?
It's an interesting question because there's a lot of uncertainty in this area, because I do get questions from the patients so often whether to fast for 10 hours, 12 hours, is it 14 hours? So for the fasting blood test, it's like 8 hours is enough. So we'd say 8 to 10 hours fasting. When I say fasting, you can drink water, because some patients they don't even drink water, scared of that they get the wrong test results. So you can drink water because water doesn't contain any calories. For the overseas, they advise to you can drink tea or black coffee. But in Sri Lankan context, if you say tea, you don't know whether it's with milk or without milk. Sometimes they naturally include sugar as well, especially coffee. They say they think coffee comes with sugar, so they include sugar. So for the Sri Lankan patients, I would just say you can drink water. 8 hours fasting is enough, but if you prefer, you can wait for 10 hours. It won't make a much difference. But if you are doing a lipid profile as well during the same time, it is advisable to fast for 12 hours, because for lipid profile you need at least 12 hours fasting.
So it's advisable for patients who go in for a blood test to stay away from solids. You can drink water, but try and stay away from solids and any drinks that might contain carbs or sugar for that matter. So
Yes,
water
yes.
is fine as long as you know what you are doing, because as you said, doctor, a lot of patients are afraid to go to doctors or for that matter hospitals. It creates probably more pressure on themselves when it comes to treatment. So one thing that they need to keep in mind is that they can drink water. So 8 to 10 hours is enough. If it's a lipid profile, then it is a minimum of 12 hours.
And other blood tests as well. There's a test called HbA1c that will give you like a average of the last 3 months blood glucose values. It doesn't need fasting. You can go at any time and get the bloods done. Then there's a thing called random blood sugar. We do it when the patient comes to the hospital with symptoms. Then you can just take a blood and see whether it's higher than the normal range. And for the patients who are at home, there's a thing called glucometer that can be used easily. It uses a strip. You can just prick the finger and get the drop of blood, and you can get the value instantly. So those are things available. In the fast, we used to do urine for sugar as well, but we are not doing it anymore, because now we have good blood tests like fasting and the HbA1c available everywhere.
So doctor, you mentioned about glucometers. What should the reading be for a normal average human?
Yes. For a normal person, the fasting blood sugar should be less than 100. So if it is more than 126 milligrams per deciliter, we call it diabetes. So between 100 to 126 milligrams per deciliter, it's called impaired fasting glucose, or we say the patient is in the pre-diabetes range. So he has he's just progressing to the diabetes if we don't intervene. And for the random blood sugar, if the patient is symptomatic, we take the cutoff as 200 milligrams per deciliter. There's a slight variation in the glucometers, but it's a useful tool. But if we get a higher value, we always confirm with the blood glucose report from the lab.
So if you are diagnosed with diabetes, what should you do?
First thing is, don't panic. Don't think it as a punishment, because 1 in 5 people in urban areas in Sri Lanka has high blood sugar levels. So you need to think, okay, what are you going to do? First, consult your family doctor and get the proper advice. I think when you say go out and say I have blood sugar, there will be 10 people offering 10 different advices. So always stick to your healthcare provider and get a proper advice. Then, depending on the blood sugar levels and your requirement, he or she might prescribe medications to you. But the most important thing is not the medications, what you do with the lifestyle. So you need to be mindful about the diet, and you need to start exercising if you are not already doing so. And those two things are the most important things apart from the medications.
And is there anything that they should refrain themselves from getting into?
Yes, I would say search the Google and don't start treatment yourself, and don't take treatment from your family members or neighbors, and get the proper treatment from the properly trained medical professionals. And there are things that our Sri Lankan citizens do, that they take herbal preparations thinking that it would cure diabetes. These herbal preparations, they will reduce the blood sugars, but it won't cure diabetes. So as long as you keep on taking them, the blood sugars will go down. For example, if I am to tell names, let's say Tebukola, then there is a thing called Masbadda, even Karavila. It is known to cause low blood glucose levels, but it is temporary. Once the chemical is out of the body, the blood sugar will go up again, and these things you should not do.
And if I may ask, doctor, we mentioned about staying away from specially ill-advised Google searches. I think that's something a lot of Sri Lankans do, and something that I think we should tell ourselves, that when there are professionals, go to them, because why they are there is for our benefit. And if you think that Google can teach you things and buy your own medicine, then you are leaving yourself with a lot of questions in the future. So looking at treating diabetes, you mentioned about how we should stay away from certain things. If I may to ask, what sort of medication we should follow? Is there oral tablets, or is there injections like in the case of osteoporosis? What sort of medication should a patient take?
Yes, Ishan, the most important thing is to start with the diet and the exercise, then comes the medications. So the medication, the commonly we use metformin. I think everyone has a negative image on metformin, but it has been there in Sri Lanka and in the world for like 60 years. It's a tried and tested drug. I know it has its own problems, but it's a very safe drug, and it's an effective drug as well. It's one of the first line things that we do. Then there are other groups of medications that we use, which acts on the pancreas. Some drugs act on the abdomen and the intestines. Some drugs act on the kidneys, and together they will reduce the blood glucose levels to the normal. With time, we modify these treatment regimes according to patients' needs. Usually people think insulin is the last resort. It is not so. Sometimes we start insulin at an early stage if the patient's clinical the disease condition needs the insulin. Let's say the patient is having some infection in their body, and let's say the patient is having COVID, then we go for insulin straight away. But when the patient recovers, we can switch to oral hypoglycemics, oral tablets if the patient prefers.
And looking at all of this, because I think one thing, like you mentioned about the tablet, even though it's been there for generations, people are afraid of certain things and certain side effects. Could any type of medication for diabetes have an adverse effect on certain organs in your system, especially when it comes to something like kidneys?
Yes. The commonly asked questions from the patients, Ishan, is that whether metformin causes kidney damage, kidney failure. They say my great grand aunt was on metformin for so many years, now she has developed kidney disease, there's no way I'm going to take this tablet. So metformin is very safe medication. It doesn't damage the kidneys, but it's in a way, when the diabetes is not controlled, the patient can get kidney damage due to the high blood glucose levels. In that sense, metformin cannot be get out of the body. So then there are complications that's coming out. So in patients with kidney disease, we tend to avoid metformin. Maybe that's the reason this myth has started. But metformin per se doesn't cause kidney disease. But metformin has its own problems. It can cause a weight loss, especially our people are very sensitive to weight. So sometimes if they lose weight, then others will ask, what's wrong? Do you have diabetes? So they say, doctor, I'm not going to take this medication. So in those kind of situations, we switch to another drug. Then metformin can cause gastritis, burning pain in the tummy. Sometimes they can upset your emotions as well. So in these kind of patients, we avoid and we go for another medication. And there are certain drugs that cause weight gain. We use a drug called sulfonylurea, like glibenclamide, glycoside, is very cheap and effective drugs, and pioglitazone. They can cause weight gain in the patient. And there's a drug called empagliflozin, which is a newer drug that can that works in the kidneys, so it can cause increased thirst. What I want to say is they are very safe drugs, because once we prescribe this drug to a person, he or she may be taking this drug for decades. So it should have a very good safety record. So these oral hypoglycemics, antihypertensives, they are long-term drugs. They are not given for like 1 or 2 days or 1 week. So they have very good safety record.
And one thing with regards to diabetes and Sri Lankans is that issues with their toes, especially with their feet and toes. What should a patient with diabetes do with regards to their feet?
Ishan, diabetes is the #1 cause of foot amputations in the world. We think it's landmines, it's not so. It's diabetes, and the unfortunate thing is it's totally preventable. And diabetes causes problems in the blood vessels, so small blood vessels. So there is reduced oxygen supply and nutrient supply to the tissues. And diabetes also damages the nerves, because when we step on something we feel it. But people with diabetes, they tend to lose this protective sensation. So even if they prick, they won't notice it until it's advanced ulcer, becomes advanced ulcer. So because due to these two reasons, their feet are more vulnerable to getting ulcers and getting amputations. So they need to treat their feet as their face. So daily they have to inspect their feet and look for any damages or ulcerations. And they need to always wear footwear. This is another problem with our country, because we remove footwear. We think footwear is only for outside, but inside the house is the time we must spend, right? So they need to wear footwear for indoors as well. So they can keep a separate wear to wear inside the house. What I tell my patients is, you can remove your footwear only when you are going to sleep, or having a bath, or going to the temple. Otherwise you need to always wear the footwear. Other thing is trimming the nails. You need to be very careful, because people with diabetes, sometimes they can have poor eyesight, so they can inadvertently damage the nail bed when they are cutting the nail. So you have to be very careful with that. Another thing is getting a proper footwear as well. Sometimes you should not wear ill-fitting footwear, because it can rub and cause blisters, which can end up with a ulcer. And the most important thing is get your feet checked at least once a year from a medical professional. All the diabetics in the country offer this service, the foot screening. What they will do is, they will inspect the feet for any damages, then they will look for the loss of protective sensation, and they will check the foot pulses to look at the blood supply. So if any problem, they will advise accordingly and will take corrective measures.
So those are gist of what we highlighted on today's edition. We've come to the last bit on the show, doctor. So as you say, it's definitely preventable. So we need to have a healthy lifestyle. Make sure what you do, like in the case of osteoporosis, try and have a healthy diet, exercise more often, and once you reach the age of 35 or 40, at least go and have a regular checkup annually, in order to make sure that you don't get yourself into this situation of diabetes. And on behalf of ChannelEye and iMed, I'd like to thank Dr. Tharanga for sharing his expertise with regards to diabetes and prevention, and especially if you are diagnosed, how you should control yourself and the type of medication that you should take. So that's a little bit of what we highlight. As we always say, health is something to keep in mind, and as we age, we need to look after ourselves more often than when we were younger. So that's to keep in mind. It's time for me to say goodbyes on today's edition of iMed. See you same time, same place next week as well. It's bye-bye from me.
Complicated.